Woman and Mr. Ranking Member and Mr. Secretary, it's nice to see you again. I appreciate the opportunity to visit with you a couple of weeks ago. I think when we visited, I had mentioned that as a new member of the committee, I was going to go back home during recess and establish a Veterans Council to hear directly from veterans throughout Central and Southern Illinois about their concerns, and so I can bring them to this committee and really be the best advocate I can be. We did that last week in Decatur. Which was great. We had a diverse set of veterans that were participating in that discussion. I also had the opportunity to visit our Decatur Veterans Clinic that we have. We have two clinics, as I know you're aware of. One of them is in Springfield, and I have to say there's a lot of excitement in Springfield that we're going to be getting a new CBOC facility there. So I do just want to mention, I look forward to continuing to work with you and your team on the progress of that CBOC, because there was a lot of great discussion around that. But one of the issues that came up during the council was around rural health care and access, and so that's really where my question is going to be focused on. The pandemic changed not only the way we care, the way care is provided, but also reshaped the actual care delivery structure across the country. As you know, more than 600 rural hospitals, which represent nearly 30% of our system, are at risk of immediate closure because of poor financial performance in 2022. And other small sites of care disappeared entirely during the pandemic, and I can say that my district is certainly not unfamiliar with this reality. While in some parts of the country the prudent decision would be to buy care from the community, it simply may not exist in some communities. VA must ensure it has developed best practices for delivering care in rural and highly rural communities like those, as I mentioned, in my district. So my question is really related to the budget. The budget request specifically notes the Office of Rural Health, quote, expects to see significant expansion of many of these programs in 2023 and 2024 as new sites are added and new rural access innovations are created. So my question, Mr. Secretary, is given what I've just outlined, can you help me kind of to better understand why the funding for our Office of Rural Health remains stagnant at FY23 levels for FY24 and FY25?
Yeah, thank you for the question. And obviously, the Office of Rural Health we've expanded that over the course of the last couple of years, and we will continue to use that as an important platform. But the medical care account will allow us, and then the infrastructure account will allow us to, using the analysis from the Office of Rural Health, to make sure that we have the care in the communities where we need it, where our veterans are, mindful, as you say, that the whole topography of healthcare delivery, especially in rural communities, has been deeply affected by the pandemic. I take great pride in the fact that among healthcare providers, VA is often the single most robust investor increasing access or ensuring access for our rural vets. So that's the first part of the answer. Second part of the answer is we're also going to continue to use the new platforms for the delivery of care, including through our Office of Connected Care, which again would not be funded by the Office of Rural Health. The Office of Connected Care will make sure that we have forward deployed capabilities in our rural communities so veterans can connect through telehealth, even in areas where broadband is not sufficient, highly rural and rural settings. So think of it as the Office of Rural Health as a key component, a key coordinator of all the other investments that we're making in rural communities. Veterans are more likely to be in rural settings, and as a result, we take very seriously the need to ensure access across all of our communities in the country.
Thank you very much. That's helpful. I'll yield back my time.
Thank you. Mr. Secretary, I think you and I are called the survivors of this briefing.
Well, I haven't survived yet. When it's done,